I'd like to welcome you to our webinar on the COVID-19 vaccine. My name is Erin, and I'm overseeing the local implementation of this program. So we wanted to offer you the chance to hear from our Acting Medical Officer of Health and CEO, and the chance to ask questions. So as they arise throughout the presentation, please enter your questions into the chat box. And at the end of the presentation, we'll address them, and then we'll also open the mics at the end for a discussion. So I'd like to introduce Dr. Corneil now. Dr. Glenn Corneil is the Acting Medical Officer of Health and CEO of the Timiskaming Health Unit. He had provided support to Timiskaming Health Unit in 2018 before returning in July 2019. He had been a rural family physician since 1997, and his practice is currently based out of the Great Northern Family Health Team in New Liskeard. He is an active staff member at Timiskaming Hospital, where his emergency medicine work had been on hold since September due to the pandemic work, but he still provides inpatient care. He also practiced obstetrics for over 20 years. Some of you in South Timiskaming may know him as a physician who had privileges in your facilities in the past. He is also an assistant professor at NASM, a past Timiskaming Hospital Chief of Staff and President of Medical Staff, and a past lead physician and board chair for Great Northern Family Health Team for 7 years. So welcome, Dr. Corneil, and thank you.
All right, Erin, thank you for the introduction. Hi, everybody. Thanks for joining us today. I'm just going to bring up my slides here. So again, thanks for obviously all that you're doing with the work throughout the pandemic, and thanks for joining us today. It's an important topic that I want to review today with you. It's timely. And it's exciting because we gave our first doses today of the vaccine in our district. We've been ready, and vaccine arrived yesterday, and we got permission to get rolling today. So we started with Tri-Town Extendicare because they're the only home officially in outbreak right now. So it's exciting times, and very much hopeful that the vaccine is going to be the turning point in getting on top of the pandemic and trying to get all of our lives and society back to normal. So what we're going to be covering today, so these are the things I'm going to be going over. As Erin said, we will have time for question and answer period at the end. We're going to do an overview of vaccine hesitancy, go over wave 2 and how it hit our area in December, talk about the COVID-19 vaccines, answer some COVID vaccine questions, and also try to debunk some of the COVID vaccine myths that we're hearing in the area. And then there's some resources at the end as well. So we'll get right to it. With social media, in the age that we're in, there's a lot of concern about misinformation that is out there. Their WHO, World Health Organization, actually has defined this as a global infodemic, and there's a specific strategy that they are working on with respect to the amount of COVID misinformation out there. And again, we're seeing more of this as the vaccine is coming to the world. And we also know that misinformation is causing significant harm. So we wanted to address this locally and help you as you move forward, as you approach making vaccine decisions for yourselves. And then as we roll out to a vaccine strategy for our whole community, it's a very important and timely topic to be talking about. As a family doctor, I've been counseling and addressing vaccine hesitancy for over 23 years. And I look at it, and this is also a strategy that we talk about as we counsel people with vaccine hesitancy, is we can break down people into 3 groups for this topic. So group 1 are the believers. Group 1 are the ones who we don't need any explanation. They've done their own research. They've had their own reasons to move forward. Luckily, the majority of people are still in group 1. So group 1 are the believers. There's still use for these sort of talks and session for people in the group 1 category, because you are also being asked for opinion. How do you base your opinion? What are the facts that you can help to educate people who may be questioning? Group 3 are the disbelievers. For whatever reason, this is not a group that is going to choose vaccination. This is a hard group to move out of group 3. But we all make our individual choices. What we're seeing with the rollout of the COVID vaccine is group 2 has been larger than we've really ever seen before. It's a combination of misinformation, combination of, though, natural concerns, natural questions. We want to make sure that people know why we believe it's the right thing to choose to be a vaccine. It was a quick rollout of vaccine, and we'll talk about that. So it's normal to have hesitancy, some degree of hesitancy. It's normal to have concerns. But what we don't want is group 2 shifting to group 3 because of misinformation. So that's part of what we're going to be talking about today. As we were preparing to vaccinate our district, the first group that we are vaccinating is focused on long-term care homes. So as we've prepared consents and talked to our different homes, a couple of things that we've seen, which are common and similar to the trends that we're seeing in the rest of the province. So first of all, there's very high vaccine uptake in our long-term care home residents, anywhere between sort of 91%, even higher for many of the homes. This is not surprising because this is an older population. This is also a population that remembers what it was like to see polio. The population that may have had children who had measles or mumps. Is a population that has seen and lived the benefits of vaccination programs. So this is not a hard population to convince to get vaccinated. They've lived it, they've seen it, and they have witnessed the benefit of vaccination programs. What has jumped out to us and has created some concern, which is in part why we're hosting this tonight, is we found an unexpectedly high level of vaccine hesitancy or refusal in long-term care home staff. And interestingly, there was quite a discrepancy in the district, specifically in the central part of the district, but also in the northern part of the district, and more so than the southern part of the district. And what we're seeing is the rates of hesitancy are higher than where a lot of the province is actually seeing of interest. And what we're hearing from the field is there is a role of a local doctor who works in the central and northern part of the district. Social media presence has beliefs and concerns which are negatively influencing vaccine hesitancy. So I am going to address some of the things that we're hearing on social media and provide you with some facts and as you work towards making your decision. So as you know, long-term care home staff, it's really a very, very important topic. You work with some of the most vulnerable populations in the province and really want to help you make an informed decision. So we all make our own choices and we just really encourage people to get informed and please make your decision based on facts, not misinformation that is surprisingly prevalent right now in our district. So why is this even more timely and why is it important? So one of the myths that are out there is that waves are a myth, that the COVID illness is over-exaggerated, that it's really not that bad. We lived a significant wave in December in our district. As you know, leading up into December, we had the second lowest rates in the province. We only had 18 cases, and with our population, that was the second lowest rate in the province. But come December, things changed, and they changed very quickly, and they changed very seriously. So as you can see from these numbers, the color coding matches the provincial categorization. Just to help, because we are a small district, we only have around 30,000 people in our district. It's important to have these numbers reflected on a case per 100,000 in order to compare with the rest of the province. So we started to see some concerns in early December, but then things shot up really quickly in mid-December and in the week of leading up into Christmas and beyond. So within 2 weeks, we'd already almost doubled our rates, and then that over doubled again in the preceding week. And these numbers were as high as anywhere in Northern Ontario at that time. But what was absolutely wonderful to see is how quickly our wave also came down. And this is really important when we start talking in a couple of the other slides with respect to herd immunity and other approaches that are out there in the social media. Just really quickly, this last number, reproductive number, is how many people get infected by each individual case. So when there's a lot of inappropriate parties, inappropriate gatherings, we were identifying a lot of contacts for each case. But then as the government moved into lockdown, as our THU CCM team, contact team did a lot of work encouraging people to follow measures, isolate if they'd been exposed, etc. And then as the lockdown happened and as the stricter provincial measures came down, look how quickly we got back down into green. It only took a couple of weeks. And this really is what happens when a community works together, follows public health measures, and there was effect of the provincial timing of the lockdown as well. And most encouragingly, we have not seen yet a bump after Christmas or New Year's like most districts in the north saw. So that's where we're at. And I just wanted to share that the screen with you. So this slide is just some facts. These are facts that we're living. These are facts that we're dealing with at the health unit. So first of all, COVID-19 second, third waves are real. We lived one. It can happen very quickly and it can be very serious. In a month, we had 66 cases. 6 people were hospitalized and 1 person died. Now we may have a wave of 66 cases and have fewer people that are seriously affected like this. But these group were elderly. This is not unexpected. It's what we're seeing throughout. And you can imagine that if those numbers had continued to rise, if we had doubled, tripled, quadrupled, how serious the impacts would have extended in the number of people hospitalized. Once people are hospitalized, they do not go home in a couple of days typically. And then obviously more serious outcomes like ventilation and deaths can happen as well. So it's very important that when we get a wave like this, that we do all we can to get it back under control, and a great outcome in December into January. We also know that the number one risk factor for bad outcomes is age, and specifically advanced age. This is obviously very important with the population that you work with. And if the waves get out of hand, if the surges get out of hand, what gets also overly stressed, and we're living this in Southern Ontario right now, is hospitals, hospital beds, ICU beds, ventilators. And then what happens is people are starting to die of COVID, but they are also dying of the other causes, strokes, heart attacks, bad infections that we could normally manage, because once the beds get full and the ICUs get over capacity, we don't have the human health resources to treat things like we normally are able to do. Another fact is that public health measures work. Some of the public health measures like lockdowns are very hard. And some of the social media stuff that's out there is absolutely correct on this topic. There are a lot of secondary negative outcomes of lockdown. But when we get surges like this, we don't have a lot of choice, because the evidence also clearly shows that as hard as they are, lockdowns and increased public health measures do work, prevent overwhelming, especially of the hospital setting, but also to decrease mortality and morbidity of infection from COVID. Okay, so herd immunity. So this is also out on the social network right now locally, that we shouldn't manage COVID with public health measures. We should do herd immunity. In other words, let everybody get it at once. For those of us who are old enough, you may remember chickenpox parties, where Johnny in the neighborhood chickenpox, let's go all over to play with Johnny, so all the kids get it at once. The difference with chickenpox is that once you get chickenpox, you never usually get it again. And the parents hosting those parties had already had chickenpox. And I guarantee you that they would not have been hosting chickenpox parties if they were also going to get sick a week later with their kids. Herd immunity was a legitimate concept. It not only was studied, a couple of countries tried it and it did not work. So, and it's because of overwhelming surges. If those waves spike up very quickly, very hard, and very all at once, it overwhelms the other systems. So that's why herd immunity has shown to not to work. The other concern with herd immunity, and we're starting to live this in Ontario right now, is we're starting to see a surge of a new variant. And right now in Ontario, we're seeing increasing cases of the UK variant. So if we had done herd immunity and everybody got infected with that variant, and another new variant gets in, if we all of a sudden have another huge wave, it would be secondarily awful for the community. So as a second variant is coming in, we are seeing people who had the original variant or a strain and now can also get infected with the UK variant. So again, public health measures are so essential. And we will see what will happen with this new variant as we're seeing increasing cases in Ontario. Okay, vaccine. Let's move over to vaccine now. So vaccine development, it's actually a very fascinating topic. This is absolutely the fastest a vaccine has ever been brought to market to get into arms, and thank goodness, because it's been 100 years since we faced a pandemic like this. It is very, very important to underline that the development and approval for COVID vaccines in Canada followed all the safety standards as any other vaccine that has been brought to market. Obviously, there was so much interest and work being done. And the key thing is that the work was done throughout the world together, and it allowed fast tracking, but not shortcuts for development of the vaccines. The vaccines were tested in large studies, over 10,000 people, to make sure they met safety standards. And they were also studied in different ages, races, and ethnicities. As you know, it made a lot of press. The COVID Moderna vaccine also was shown to be effective and safe, with over 94% people after they getting the second dose having immune response to the vaccine. So again, there were no shortcuts taken in this approval process. Medical officers of health were able to have a couple of significant presentations to go through to reassure that the vaccine had been brought to market as per usual vaccines. The other thing to me is important to note is there's other vaccine trials going on. We really need as much vaccine as possible in the province. We've seen when Pfizer production dropped how much impact that's had. Some countries have approved the AstraZeneca vaccine, but Canada has not. Actually, I'm ahead of myself. This is coming up in another slide. There's not quite enough data. It hasn't met our safety protocols. So again, there are no shortcuts being taken with Canadian approach to vaccine approval. This last point is the important point, though, is the reason things were able to be fast-tracked is the international vaccine development initiatives happened in parallel. So usually what happens is we go phase 1, phase 2, phase 3, and rollout. And what was able to be happen with approval is that phase 1 was able to be started and phase 3 quickly started, which really helped get vaccine to market quickly. But all of the phases were undertaken, including phase 1 trials on animals. Some more facts about vaccines. So the first two COVID vaccines, the Moderna and Pfizer vaccines that have come to market, are interesting vaccines. We've never had mRNA vaccines before, but it's important to note that research to try to develop mRNA vaccines had been going on for decades. There were problems that weren't able to be solved until the whole worldwide community, or much of the worldwide vaccine community, focused on vaccine development, and they were able to solve the issues, specifically stability at room temperature, which is why these two vaccines need to be stored in a -20 or -70 freezer. So it was solved, and it was solved quickly, and it's exciting technology. One of the resources at the end that I'll link for you is a 5-minute whiteboard video explaining mRNA technology and how it was able to be used to create vaccines. Also in passing, mRNA technology is used in some of the modern medications as well. So second bullet was just what I said about the AstraZeneca vaccine. I did want to share the update adverse events following immunization because this is being very closely studied by Public Health Ontario. As of January 16th, over 200,000 COVID vaccines have been given in Ontario, and there have only been 43 adverse events that meet criteria. This is wonderful news, and it's consistent with what we're seeing with rollout of the vaccine to the field. Of note, of the 43 that have been classified so far, none of them met the public health definition of what a serious event is. Almost half of the adverse effects were the typical local skin reactions that we see with vaccination, a little bit of swelling, redness, itching at the vaccine site. Again, at the end, I will link you to the PHO website so you can follow that. It's broken down weekly, and it's also broken down by health units. And it's something that the field is following very, very closely. And so far, so good. So I'm going to shift gears a little bit. We didn't get a lot of questions from the field, so I just threw down some that I get commonly asked, that our team gets commonly asked, and many of you may have these same questions. And then we'll shift over to myths and open it up to all of you to see if you have any other questions as well. So why are long-term care homes the focus, and why are long-term care home workers specifically the next group that we're going to be vaccinating? So Number one is we know that vaccinating this population, so long-term care home workers, will save lives. You work on the front lines, you work with some of the most vulnerable people in the province, and you also work in the facilities where we've seen some of the most serious outbreaks throughout the pandemic. For yourselves, vaccines can help you from not getting sick, can help you from not missing work. It can help you from not passing on to vaccines to your loved ones. Sorry, not vaccines, not passing on illness to your loved ones, and also not for you getting seriously ill, but also to help prevent you from passing it on to the vulnerable patients that you work with. It is important that even if the long-term care home residents are vaccinated, that some people do not have a great immune response, and we're seeing that most commonly in the more elderly. It's again something that's being studied and followed closely. So residents need their vaccine, but they also need to still not be exposed to COVID when the people are working with them. And that's why your group is such an important population to get as many people as vaccinated as possible. Common question that's coming up now as we're seeing more evidence of the UK variant is, do the vaccines work against the new variants? So far, so good. There's a lot of study going on in this, especially in the UK. The main studies have been specifically for the UK variant. The Brazil variant and the South African variant, not as much evidence right now, and that isn't as known, but we aren't seeing a lot of that so far in Canada. One of the interesting things about the way mRNA vaccines are developed, though, is they can be modified quite quickly. So if we see more and more evidence that vaccine is not working out against the strains, the companies can actually shift quite quickly, very similar to what we do in a different format with the flu shots, right? Every year, the flu shot is based on the strain of the flu that we're expecting in the area. mRNA vaccines could actually be created even faster to address what's going on in the field. So I touched a base almost on this, but can I still get infected with COVID-19 if I get the vaccine? So again, comparing to influenza, we're starting to see, while most people don't get COVID, there is some evidence that some people can still get COVID-19, which is why after vaccination, which is why the public health measures are still important to continue even after you get vaccinated. There's a lot of study being done on this right now, but you know from the flu shots that even with the flu shot, you can still get influenza. But what we're seeing is if somebody gets sick, despite being vaccinated, or if they get symptoms, they're often very mild. And so there is still protection. So even if for the few people that seem to get it even after vaccine, if they do get it, it's mild and also will prevent admissions and missing work, etc. But that also impacts contagiousness. And this is some of the things that are being studied right now, is while we believe the vaccine is very protective, it very, very much decreases contagiousness, the rates are still under study, which again, is why we have to keep up with the public health measures until a large amount of people are vaccinated, until we have more scientific data on that specific issue. Another common question is, like the flu shot, will we need to get an annual COVID vaccine shot? And right now, we don't know. It's going to depend on how the virus evolves. It's going to depend on how the response to the vaccine results, and too soon to know, but it's something that's being closely studied. And if I was you, one of the main questions I would be asking is, can I finally stop getting my weekly nasopharyngeal swabs if I get vaccinated? It's coming. They're trying to bring the pan-bios and the rapid tests to long-term care home staff, so we don't have to do the nasopharyngeal swabs with you. The focus right now, though, is getting residents and staff vaccinated, and then there will be some public health direction on this. And so stay tuned. Hopefully we will be able to shift in some direction for you on that topic. Oh, this is a big, sorry. Hey, great question that I did for myself. Can I get the vaccine if I have allergies? So this is something that has really evolved over the last couple of weeks. So originally, the messaging was, if you have allergies, whether it's to medication or to the environment, to be careful with respect to vaccine. This has not been the case as we brought it out into the field, and the Canadian guidelines have shifted on this over the last couple of weeks. So very clearly now, The only people with allergic concerns who should not get the vaccine or at least get medical direction is if you've had a reaction to your first dose, or if you have a known allergy to one of the contents or the stabilizers or one of the things that are in the vaccine. And so if you have any concerns, please talk to your primary care provider, and you may even need a consultation with an allergist specialist to get direction on that. But for everybody else, so even if you've had serious reactions to other medications, or if you've got serious environmental allergies, you can get vaccine and get the COVID vaccine and get it done safely. Our clinics will have all of the usual precautions with respect to epinephrine on hand, etc. But there is very clear direction on that topic over the last couple of weeks. So a couple of quick other ones. Will children be able to get the vaccine? So we don't know yet. Right now, one of the vaccines is 16 and above, the other is 18 above. There's a lot of specific studies in this population to make sure it's safe and that it works. So there will be more to come on that. We certainly hope and anticipate by the time we run out mass immunization clinics to the general population in the summer, hopefully, that children will be able to get vaccinated at that point. Similarly, for pregnant and breastfeeding women, the studies are ongoing in this population right now. We are very reassured, because this is not a live vaccine, that it will be safe in this population. And what the present recommendation is for pregnant and breastfeeding women to please consult with your primary care provider to go over the latest evidence and data. There are a number of pregnant and breastfeeding women, though, who are getting vaccinated and having it done safely. But the more definitive studies are ongoing at the present time. Similarly, for people who are on immunosuppressant medication or who have immunocompromised underlying medical illnesses, the direction is to please talk to your primary care provider. There are a number of people in this category who can safely get vaccinated, but the direction at the present time is please talk to your healthcare provider. What we are not recommending, though, is you do not need a written attestation to show us when we're there to help you be vaccinated. We just need a verbal attestation that you've talked to your medical provider and that it's okay for you to safely get the vaccine. All right, just going to wrap up with a few vaccine myths. These are very much based on what we are hearing with local social media and some of the influencers. So we'll just go through these quickly, and then again can open up the subject up to question as well. So can the vaccine give me COVID-19? No, absolutely not. As I mentioned earlier, these are mRNA vaccines, which are created from pieces of COVID-19, specifically pieces that are involved with the spike protein on the surface of the COVID virus. It is not a live vaccine. You cannot get COVID-19 from a vaccine. This is a common one, and I hope this presentation has helped address this. The myth that the vaccine isn't safe because shortcuts were taken during development. There were no shortcuts taken during vaccine development. I addressed that earlier. But just to reassure that all phases of vaccine development were undertaken. Again, from the social media, the influence we're seeing is you can't trust the vaccine because animal studies weren't done. This is absolutely not true. Both the Pfizer and Moderna vaccine did go through phase 1. They did go through animal studies. Specifically, they were done in mice and macaques, which I believe is a form of monkey. And the last one I'll just comment is there's a lot of rumors out there that all you need to do is take high doses of vitamin D and zinc and it'll prevent you from getting COVID-19 infection. And believe me, as a frontline worker, as the medical officer of health and all the work that we do with COVID, I certainly wish that this was true, but it's not. There is no evidence that these claims are all true. The other thing to remember is that high doses of vitamin D in some people can be harmful. So again, please be careful with some of the recommendations you might be seeing on social media or from people who are either anti-COVID, anti-vaccinators. Now, there are a lot of international studies on a wider range of therapies. Hopefully there will be some that are identified through thorough medical science, evidence-based research that we then can bring to the field, because we are very keen to also find things that can help certainly something as nice and simple as vitamin D or a mineral like zinc, but the research is absolutely clear that it has not been shown to be preventative at the present time. And that'll segue into my last slide, which are some resources. I'll leave that up for a few seconds if people want to take a screenshot. Just again, these were some of the resources that are as up to date as I could find for you. Specifically, that 5-minute YouTube video, you might feel like you've been brought back to high school or university biology, but it's quite fascinating to see. Again, this is the link for the Public Health Ontario adverse events. So you yourselves can watch week by week to see if we're seeing concerning trends, but obviously this is something on your behalf that we are watching very closely. The Alberta Health Services just did an update, I believe it was last week, on the latest research specifically about vitamin D. So posting that for you as well. And as always, the Timiskaming Health Unit is here. It's here to support you. It's here to answer questions. We are really doing a big update on our website. There's a COVID-19 section, obviously, but a specific section on the COVID-19 vaccine as well. Starting tomorrow, we're also going to be documenting in our forward-facing chart how many people are being vaccinated in the area. We know that the equivalent of herd immunity, that the major protection that a community or district gets from vaccination is when we can get 70% plus of our population vaccinated. So it really is the key. It's the light of the tunnel. It's what's going to solve COVID fatigue, and it's going to get us as back to normal as we can as quickly as possible. Timiskaming Health Unit is spending a ton of work getting ready, and we are looking very forward to bringing the vaccine program to your long-term care home and then to the community as a whole once we get vaccine from the province. So thank you very much for attending, and I'm quite interested in questions if you have questions. So I'm going to take these slides down. Please reach out if you would like anything else from us from today's talk. And again, the talk has been recorded as well. So over to you, Erin.
Hi, Glenn. We have a comment from Joanne, who shared the success story of the Tri-Town Extended Care vaccination today. And she said everything went smoothly. They're supervised for 30 minutes, no side effects reported. And then Corinne had a question. Is the injection a biologic or a synthetic?
So to answer the questions gets into the pretty deep into the science. So a lot of time we talk about biologics or synthetics with respect to medications. So a lot of vaccines are created from either the virus itself or dead products of the virus itself. And what's interesting with the mRNA vaccine development is they've actually taken pieces of mRNA. So it's not the virus as a whole, or it's not chunks of the virus. It's really specific little pieces of mRNA that is derived. So it's, again, I don't know the answer if it's technically a biologic or a synthetic. It is what's called an mRNA vaccine, and that's how it's being derived. But the exciting thing about it is because it's the way it's being developed by recording off or developing off little pieces of mRNA, it also allows very quick adaptation, like I said earlier, to change the vaccine if it's not working. So it's very exciting science. Like I said, it's been decades in the making, and it really is what allowed it to come so quickly to the field, which has never been able to happen before with the way previous vaccines were developed.
Thanks, Glenn. If anyone else has questions, we invite you to enter them into the chat box. And I'll just see if our facilitator can open up the mics to allow people to unmute themselves. And you can also bring questions forward for that.
Yeah, I believe there shouldn't be any issue with folks unmuting themselves. I think that technologically it should be smooth, but if anybody has issues, just let us know in the chat and I'm happy to troubleshoot.
And just before I go on, I meant to say this at the beginning, we are accompanied today by some of the medical doctors or the directors of the facilities, and certainly to my colleagues, if you have anything that you'd like to add or comment on, please feel free to do so as well. Certainly, if you're hearing things in your home or on the field that you would like to bring to this talk, please feel free to unmute and jump in as well.
Hi, Glenn.
Hi.
Okay, you can hear me. Yeah, I've been hearing a lot of stuff too. I've been looking stuff up. Let's see what some of my questions are. Some people I've seen would consider this a medical device or gene therapy. Do you agree?
Yeah, absolutely not. Thank you for bringing it up. One of the things that we have heard rumors of that we didn't actually even think of, I didn't even bring to the presentation, is the concept that maybe there's a chip or some sort of tracking device that's in the vaccine, that there's, and again, part of the conspiracy theories a little bit, suspicion of government. I could categorically tell you that I couldn't imagine the cost of having to be able to do that, what the science would entail, but there's absolutely no way that there's anything in the vaccine that could somehow allow the government to be tracked. Now, sorry, you said the second part of that was not biological.
Or could be considered gene therapy. I read something that originally Moderna was a cancer therapy company, and they've sort of stumbled onto the BioNTech technology and are using it, you know, and the sense that it's a medical device is that it may not be a live, attenuated, or non-live version of a vaccine under those definitions. And so my second part maybe be, how is this defined as a vaccine? Under what definition is this considered a vaccine?
Sure. So a couple of things on that. So first of all, it's not a device. A device would be, again, going back to the idea that something is being injected with the vaccine that's going to be implanted in an individual. Absolutely not the case. Gene therapy. So Moderna and other companies have been studying mRNA, ways to bring that to therapeutics for years now. So mRNA-derived medications have been out in the field for a few years now. So absolutely, Moderna and other companies have been studying and finding ways to use the mRNA technology to bring interventions of benefit to the field. It's not gene therapy though, and I encourage you, if you had a chance to write down that link to the whiteboard, it really does go into what an messenger RNA is, how it can be used to create vaccines, and this is absolutely a vaccine. So the idea behind a vaccine is so when we get exposed to a virus, our body or a bacteria, our body mounts an immune response. And that immune response not only fights off the infection, but also lives in our body as memory cells, so that if we get exposed again to chickenpox, our body is ready to fight it off and not get infected again. So the idea behind vaccines is you introduce, usually by injection into the muscle, a small amount of something that allows our body to recognize it as foreign and then create an antibody or immune response. And then that memory is there in our body. So after the vaccine, if we are then exposed to COVID, to the actual virus itself, our body recognizes that the spike protein or the surface of the virus in these mRNA vaccines is foreign. And our immune system cranks up, attacks, suppresses, kills the virus, and then we don't lead to infection. So that's the way all vaccines work. It's a way to create immunity in our bodies so that when our body is faced with the illness, we can fight it off and not get sick. And if we look back, in all the society, in all the time of humanity, arguably with clean water, vaccines has probably saved more lives than anything else that humans have ever created. So. So a couple of parts of that question, but I think I I answered them all, but certainly expand if you'd like.
Thank you. I do have other questions, but I'll let other people interject here.
Super, thanks. We'll come back to you. And somebody just posted in the chat box that just to be aware too, that the Ebola vaccine is also an mRNA vaccine. So thanks for putting that up there. So, and also in the chat, Kim posted the 5-minute YouTube whiteboard video if you'd like to review it as well in light of those questions. So, next questions. Not hearing any. We can go back to the same speaker. Oh, sorry. Sorry. Just before you do, sorry. One popped up in the chat box, and I'll head back over to you. So, is it safe for people with underlying medical conditions to get the vaccine? So, the majority of medical conditions, absolutely. The ones that we are asking people to, when in doubt, check with your primary care provider. But specifically, people who are on medication or have illnesses that affect your immune system. Those are the ones that we just want you to get direction from your primary care provider. The reason being goes back to what we just talked about, is a vaccine induces your body to have an immune response. So there are some medications and conditions that prevent you from mounting an immune response. So it's not that the vaccine is not safe for most of those people, is that it may not work that well depending what you're on. So that's why we want you to obviously there's a bunch of different things that are out there, but by far the majority of underlying medical conditions, COPD, diabetes, heart disease, dementia, depression, schizophrenia, all of these things are perfectly fine and not a contraindication to vaccination. And I talked about the special population. Pregnancy is not a medical condition, but again, that's the other category, pregnant moms and breastfeeding, to seek out direction from your primary care provider before vaccination. Okay, so over to the questions, and as people might be typing, so go ahead.
Hey, Glenn, it's Dustin again.
Oh, Dustin, okay.
And I appreciate you you doing this. I'm probably in the camp number 2. I'm more waiting for the Johnson & Johnson vaccine. I think it's more of a classic vaccine. Do you have any opinions on the between the two, the RNA and the Johnson & Johnson?
Yeah, I think part of the hesitancy for group 2, again, is completely normal, is that naturally we want to be informed when something's new, right? There's sometimes underlying suspicion, underlying concern. But what's interesting is what we're seeing in the world vaccine hesitancy studies is that vaccine hesitancy is starting to decrease because people are seeing that the mRNA vaccines are not only safe, but they're well tolerated. So they're actually studying that group that wanted to wait, wanted to let others go first. And what they're seeing is as your neighbor gets vaccinated, as your doctor or as your grandpa at a nursing home gets vaccinated and is fine with it, and as we start to see the vaccine making a difference in long-term care home, the hesitancy, for example, is one population, the hesitancy in that group is decreasing, and is decreasing fairly quickly, which is really important to see. So I can only answer you sort of from my own personal point of view. I've done a lot of reading and research, obviously, on mRNA vaccines. I'm very, very excited by what they're bringing to the vaccine world and the vaccine field. You are all individually going to make your own decisions. I have no hesitation about myself getting an mRNA vaccine. Now, if you're healthy, if you're on the younger side, the wanting to wait, that is certainly an option. The concern is if you're working on the front lines, if you're working with vulnerable populations, we don't know when the Johnson & Johnson vaccine is coming, for example, same with the AstraZeneca. We're hoping it's coming soon, but what we're seeing with what's gone on in long-term care homes, what we're nervous about with respect to the new variant, my recommendation for for you who work in long-term care home facilities is to not be afraid of the mRNA vaccine, but your own decisions. But certainly for me individually, if the mRNA vaccine is available for me, I will take it without any hesitation. The other thing that will be coming probably with the AstraZeneca, Johnson & Johnson, is these other vaccines that are coming. The more, like you said, the more traditional ones are stored in normal fridges. So it's going to be a lot easier to roll those out for the mass immunization clinics when we're vaccinating thousands of people, per week. So we'll see what is the vaccine that we will be using at that time. It may be a multiple vaccines depending on the different settings. It'll be fascinating to see what gets rolled out as we move to that really the big mass immunization programs that the health unit is going to be running later on in the year. I'll just highlight, Kim did in the chat room, if you see it, did post the Moderna fact sheet, which is again, Pfizer has a similar one. We have gotten the Moderna vaccine. Just one thing to be aware of, whatever you get as first dose, you will be getting as your second dose. So we don't do Moderna as shot 1 and then Pfizer as shot 2. It has to be the same vaccine for both shots. Another question in the chat box, is the vaccine mandatory for all long-term care home staff? So the answer to that is no, it is not mandatory. One of the things though, the homes are going to have to decide is if somebody decides not to get vaccinated, what's going to happen if there is COVID at high levels in the community, but specifically what's going to happen if there's COVID in the home. Similar, there may be some decisions with schools and things like that. This time last year, we were living that with pertussis. So when we had the whooping cough outbreak in our schools, for teachers who did not have pertussis vaccine, there were some decisions that those teachers were going to have to decide when there was that outbreak in their school, would they work or would they not work? But I think the province has said pretty clearly that there will be no mandatory requirements to vaccinate, but there will be decisions that will need to be made potentially down the road for those who choose not to be vaccinated.
Hi.
Hi.
Hi. I just have like a point that was comforting. My name is Brooklyn, by the way. I was speaking with a pharmacist regarding the vaccine, and she gave me something that, like a piece of information or perspective that I found was like really nice to hear, was that in terms of our understanding of mRNA and how it works and the development of a vaccine, we have a lot of knowledge regarding that. We don't, however, have a lot of knowledge of how COVID is going to affect our systems and our systems moving forward. So right now, the leaders who are creating this vaccine have a great understanding of how the vaccine is impacting our body and working in our body and how that works, but there's still so much unknown about COVID itself. So in terms of whether we're getting the vaccine or whether we're getting COVID, it seems that there's more information and we have a better understanding actually about the vaccine more so than the actual virus.
Yeah, Brooklyn, thank you for sharing that. That's a really nice way of saying it. Next time you see your pharmacy friend, give them a virtual high five for me. That's a really good way of presenting it. And it's about risk stratification as well, right? I said earlier that the highest risk for bad outcome is age. But we also know that 50-year-olds can get very seriously infected. We've seen awful outcomes in 20-year-olds. And while the majority of young people will get over a COVID infection fine, many don't even know they had COVID infection. We also know that we cannot predict who is going to get very sick with it. So thanks very much for sharing that. That's a really nice way of commenting on the risk stratification, right? The balance that people go through as they're deciding, am I going to get vaccinated or not?
Hi, this is Joanne. I just want to make a comment about, I'm sorry, I don't know who spoke about waiting for the Johnson vaccine. I mean, we've been waiting for 10, 11 months now. crossing our fingers that it doesn't get into our homes, crossing our fingers that if it does, we can contain it. And God knows we have very bad homes. So we've been PPEing, we've been spraying, we've been doing everything that we can. So when the vaccine came, I mean, why pass the opportunity of having, 90-some%, being 95% effective, 94% effective, versus just waiting for another one and, risking that it becomes a sad story like the Barrie home. So, I mean, people embraced it. The POAs were so happy when they got the call yesterday that we were vaccinating. They were ecstatic. The staff was ecstatic. We feel like at least we're giving them some protection. And I think this is what we need to do and we have to do.
All right, thanks for sharing that, Joanne. It also does remind me, there's a couple of things that I wanted to mention and I forgot earlier. So what the studies are showing is that after the first dose, we're seeing about 80% plus effectiveness. And then it takes the second dose to get above that 94%. So there's ongoing research and studies to see exactly what that number is. There's one small study that suggested, at least one that I'm aware of, that suggested that there wasn't as much as 80%, but we know, and again, it makes sense with the way the vaccine works, is that even after the first dose, there's substantial immunity that we get with the first dose, but it's that second dose that really tips it over and also allows for longer, we'll see how long, but it's second doses that by re-stimulating the memory cells creates a long-term immunity for many vaccines, and we're quite expecting the same thing for mRNA vaccines as well. So the other thing that there was, again, with I forgot to mention it, with some of the social media stuff, there was some quoting a country had a surge in bad outcomes or even deaths after vaccine. I think it was in Norway. Norway's clarified that there was no concrete evidence that that was the case. There's certainly been no surge in deaths after the vaccine initiative started or caused by the vaccine. The other thing too is, as you know, the Johnson & Johnson, the more traditional vaccines, there's no guarantee that they're going to be coming to market or when they're going to be coming to market. Because things aren't being, there's no shortcuts, right? So holding off to the other vaccines, it's a balance for things, but the other answer, of course, is we don't even know when the Johnson & Johnson is going to be coming to the field. Best case scenario is AstraZeneca and Johnson & Johnson. A point along these lines was just put in the chat box. How long does it take to reach 80% effectiveness after the first dose? Good question, putting me on the spot a little bit on that one. I don't know exactly from a day point of view, but certainly it's quick, and certainly that is before the repeat vaccine. So Pfizer is 21 days at the earliest, 28 days at the earliest for Moderna. So we're talking days to a week, I believe, Joanne, but I don't remember the studies that quoted the 80%, if they were studied at the 1 week or the, Francine, if it was studied at the 1 week or the 2 week mark. But I can certainly open that up to my team. Anybody remember a more specific answer? Certainly the other physicians on the call, anybody know a more specific answer to that one?
Glenn, it's Don. My understanding is it's 2 weeks.
That the study was done?
Yeah, that it's 2 weeks to get that immunity from the first dose up to its max. That's what I've read in several places.
Yeah, great, thank you. I couldn't remember if it was 1 or 2. I think it depended on the study as well, but thank you for jumping in. So not seeing anything else being tapped in the chat box. Does anybody else have any other questions? I think Dustin, you may have just unmuted.
Yeah, I got some more questions, if you don't mind.
Sure.
Yep. Here's one. After the FDA gave emergency youth authorization for the mRNA vaccine, Canada approved it a week later. What sort of tests or what sort of regimen did Canada put the mRNA through?
So there was a unprecedented level of sharing of research in the vaccine community. So while one part of a study sometimes was done in another country, Canada, as long as it met our stringent criteria to be an acceptable study, would use that study instead of having to reproduce all of their own studies. So absolutely, there was sharing of information, there was sharing of research, and but as you've also seen, for example, AstraZeneca is also being used in some countries, but to meet Canadian criteria, it has not met the criteria yet, and there's more data analysis going on. So, to go through all of the steps would that's in a presentation in itself, but Canada has its own stringent criteria, irrespective of what other countries are doing, but also sharing data and information that's coming out of other countries.
Okay, I got another one. This may be more along the line of the myth, maybe.
Mm-hmm.
So previously there was SARS and MERS, and I believe they attempted vaccines for those, and they never got FDA approval. From a little bit of research, I've seen that the vaccines were effective against SARS and MERS, but when the subject encountered a wild version of the coronavirus, it was more serious. Is there any validity to that?
So again, you're getting down to, questions that are very appropriate, and obviously you've done reading on this, but it's getting down to levels that is not at levels where I've read about, because obviously a lot of the focus has been on COVID-19. But I know that a lot of the research work that had been done with coronaviruses, specifically SARS and MERS, was able to be quickly used to help develop the COVID-19 vaccine. These vaccines that we're seeing, we've never had to develop a vaccine to a coronavirus that ever made it to market. Certainly what you said with respect to a bad outcome with respect to the SARS vaccine maybe not working at a wild or a more serious version of SARS, there's been no evidence of that with respect to what we're seeing with the COVID-19 vaccine. But it did help that there was vaccine work that had already been gone on for years post-SARS. People may not know of MERS, but it was a Mediterranean coronavirus called MERS. And again, I'll open up to any of my colleagues on the phone if anybody else has anything more specific on that, but certainly it's not something that we've seen with the COVID-19 vaccine world.
Hi, Glenn, it's Don again. I have read a fair bit about the SARS, and my understanding is they did develop a vaccine, but it was shelved and it was not put into development because the outbreak ended and it was basically gone from the planet. So to the other point, I have no idea, but the vaccine did not need to be used.
Yeah.
And unfortunately, COVID is very different, right? It's a pandemic, whereas SARS did not turn into a pandemic.
Yeah. Great. Thanks, Don. Would anybody else like to jump in with a question? Oh, I see Aaron. We must be getting close to the hour. Yep.
Just being conscious of time. Did you want to wrap up, Glenn?
Sure. Yeah. And I'll just point out that Kim in the chat room did also just put another link to how COVID or just how vaccines are developed. So yeah, thanks, Aaron. I think I'd like to wrap up by thanking people for their attendance. We have recorded this and it will be shareable. I really thank you for your questions too. I love these sort of dialogues and listening to what you're hearing and what are going on in your concerns as well. This really is the light at the end of the tunnel. It's a very, very exciting time, and you will all be making your individual choices. And I sincerely hope that you found this hour to be helpful, and do reach out if other questions develop. So thanks for hosting.
Thanks, everyone. And we'll make sure we circulate the recording of today's webinar with the directors of care and administrators, so you can get that as well. Okay, thanks, everybody.